Sawadika, this is your host Kusuma Yothasmut. Welcome to Thailand today. Do you live a healthy life? Having a good health means you need to eat a healthy food, live and work in a clean, polluted-free environment, and have access to quality health care and medication. For 24 hours, everything you come into contact with you must clean, and must be clean and will not be harmful to you, the air, food, water, your home or workplace. Is it possible to have a healthy environment in real life? And one can only do so much. What the government or health authorities are doing to protect us to ensure to lead a healthy life? Thailand Today will have the answer for you. With me today is Dr. พรเทพ สิริวนารังสรรค์ He is the Director General of the Department of Health who will elaborate on the issue of environmental health and the Thai Environment Health Day. Please join me to welcome Dr. พรเทพ สิริวนารังสรรค์ He is the Director General of the Department of Health. สวัสดีค่ะ
สวัสดีครับ Good afternoon.
Good afternoon. And welcome to Thailand today, sir.
Yes.
I know you're a busy person, but we need to convey the message to the people.
Yeah, very important that people have to know what is going on in Thailand, in the world.
Yes, of course. Yeah. So first, when we talk about environment, we need to know about the history of the national environment health in Thailand.
Thailand is very lucky that the King Lama V have enacted so many law and initiate a lot of department, especially the public health department. And it was more than 100 years ago that we have hospital, 130 years ago. So this is a starting point of sanitation, hygiene, and public health that related to the environmental health problem. Yes, long time. So we have a long history. Yes.
Many people are very familiar with the environment health. So what does it mean?
It is the, as you know that the people to get sick is related to the environment, to the host himself, and also to the disease, the bacteria or viral, and also the hazard. So the environment as such itself can be good to people health or to bad up to the people health. For example, the environmental hazard, environmental problem will create a lot of diseases. For example, the gastrointestinal diseases.
Okay.
If you take very dirty and have a lot of germ to your body, you have a gastrointestinal diarrhea or peptic ulcer. Second, the most important that the polluted environment will make your respiratory tract very bad and very easily to have bacteria or viral infected. This is the second big problem in Thailand, like in Chiang Mai.
Yes.
Or in the north, if
they have the mist.
The mist will induce a lot of allergic, also induce a lot of respiratory or lung carcinoma in related, and also lastly the hazards. The hazards of the environment, which is include chemical, or also a lot of polluted particle or chemical that will induce a lot of carcinoma. This is very important that we know that a lot of Thai people we die from carcinoma. the most important is carcinogen from environmental health and all the contamination that human imported into the food onto the water. Now we have added a lot of additive into the food to prevent the food
to get spoiled,
to protect the food to have a lifelong. That is a lot of chemical added into the food. This is one of the section that we have to control in. We call the environmental health.
Yes. For this, what measure the government or the people should be fair to for this kind of thing?
We'll talk later on, but
Yes.
the most important, the second thing, as you know, for the urbanization, people tend to live comfortably.
Yes.
We enjoy to do less, but consume more. So a lot of plastic, foam, and garbage on vast is produced every day. Every
Yes.
people, one
Yes.
day
Yeah.
produce how much of waste. For the solid waste, 1 kilogram for one person.
Goodness. So
Thailand, we have 60 million.
Oh, yes.
So we have 60 million kilogram
per day
that we have to
Goodness.
take care.
Goodness.
So
yes.
not only the solid waste, we also have a lot of air pollution, also the noise, also many not solid infected waste infected and
Yes.
chemical and all the hazards. This waste had been spoiled around the country. As you hear that during the heavy raining, this 2-3 weeks ago,
Yes.
it's obstructed our water flow.
Yes.
And this is to make a lot of area in Bangkok had been flooded. So this is the big problem of the urbanization. And Thailand, we are also in the phase of taking care and managed. Because before, during this few years, to the past, we don't have the budget. We don't collect the tax or any token from the people who produce 1 kilogram to take care.
Okay.
So we have to use our other tax from the local tax
To generate to those.
to make the waste to have a landfill or burn or incinerator that will take one baht for 1 kilo.
Okay.
This is a cost.
That is a cost.
But nobody know that this is a cost. So nobody want to pay for. So all the garbage, all the waste, especially the solid waste, is spilled everywhere, and nobody take care to make it underground or landfill. That create a lot of environmental problem.
Yes.
That is so right now 1/3 of the waste had been treated properly, but the rest 2/3 still not managed well. This is the big problem of Thailand.
Yes.
So that is why we have to enact a new law to collect money from the people. Every household have to pay 150 baht
A month.
if they produce more than 150 kilogram a month.
It's already set up into the rule.
Yeah, it's on the process.
Oh, the process.
Yes, the
Okay.
process. But if any local authority, they say that they concerned about the water, they might not collect that money, but they have to have another money to take care. That's why the new enacted law will have a punishment to the local authority if you don't treat it very well. This is a new era of Thailand that will take care of all the hazard and the waste. including water, solid, air pollution,
Yes.
and infected or chemical hazard. This 5 items we have to take care very well. Otherwise, especially for the chemical, the heavy metal that in my telephone, in the battery,
Batteries.
the cadmium and or the lead, cadmium and lithium.
So, doctor, could you make it black and white to tell to the people, because first of all they should be educated on how to divide the garbage
Yes.
in their household.
You know the garbage is divided into 4 categories. The first
Yes.
is the reuse,
Reused,
recycle.
yes.
The second is the infected garbage.
Okay, that is medication.
And the third is chemical and hazardous garbage. And lastly, the disposed garbage. It means all the organic garbage. So for the first one, we can. It is nearly half of the garbage is solid waste that can be recycled, reused, or
Yes.
separate. For example, the glass,
Yes.
useless glass, bottle of beer, that use of the bottle, plastic bag, and the bottle water, plastic bottle water, metal,
Yes.
the wine, and so on. Even your clothes,
Yes.
that can be reused or recycled.
Yes.
Also the paper, newspaper, and so on.
Yes,
If the people in the household, every household, if they separate those garbage into one by one place, that will reduce more than 50% of the garbage.
Oh, really?
Yes. Nearly maybe it's not at that much. Maybe 1/3 of the garbage can be separate. And for the country, in the countryside, in rural area, a lot of local authority started to encourage people to separate all the solid garbage into group of session, and they sell in the village. They have a market. ตลาดนัดนี่อะไรนะ
A local market.
They will ask the buyer to go to the village
The local market.
every
Yeah.
10 days to buy those,
Oh, really?
Separate.
Interesting.
and those money will go to household. And now that there are a lot of village put into the so-called the bank, garbage bank. It means every people will bring their separate garbage, reused to the village health, and weighing and calculate how much and put into the banking system. Every household will have their note, the bank note, the bank book, and then add it into the bank note.
Very interesting.
If it more excess more than 300 baht, they can
Draw.
withdraw the money.
Okay.
And after 300 baht, they will have a funeral insurance
Oh.
for the member. Every household, if somebody pass away, they will every household in the community will give 20 baht for the funeral.
sharing charity. Yes.
So this is very good example, and now it's practice around the country.
I see.
For the urban setting, the people tend to stand alone and no participation. For the small group or in a very very close community, the old or the previous community, they can have a linkage, and then they set up their own community. They can do the same as in the rural area. But for the people who are rich or have enough middle income group, they don't conscious of what to sell, but they conscious to collect, to separate. So they can give those paper glasses to the charity. And now we are encouraging all the department store to open up a tank to collect all the separated garbage or waste, solid waste, and give it to the charity. If we can do that, we can reduce 1/3 of the garbage. And also for the second group, that very important that if the community or the local authority can collect all the organic garbage, the wet garbage, to make to go through the process of EM and fermented EM, and then make juice of the to be
fertilized,
natural fertilized. A lot of community can do so, and nowadays, as I am also council of Bangkok Metropolitan, and also initiate at least 10 districts of Bangkok will start to collect one by one household for the organic garbage, organic waste, to make a fertilization. And in Phuket area, Popsuk village, they collect every day, and they can sell 10,000, 100,000 baht of the fertilization. After treat that, the garbage become not smelly, and you can dry and mix with all the leaf or the tree bark that make it smaller, and then you can sell at the fertilization.
The Environment Health Day seems to be very important for the Thai people. So you're going to what activity you're going to have on July the 4th?
Yes, before we go to that, the 4th of July, I have to tell you that under any law, we have to have good people to intervene to make the law working. For public health law, as you know, our local authority is so small and so young. They have many problems. So we have to have provincial subcommittee. The governor of the province will chair the subcommittee, and they will every month sit together and take care of all the environmental problem in the province, with the help of many ministry representatives sit in the community, and they will take care and get rid one by one problem and cooperate solve one by one problem. So this is hopefully we have national plan. We have this department or ministry action plan committee, and we have national and environmental health committee to make a plan to be possible. This is what the government tried to move to make the environment problem to solve all the problem. However, during the few years, with the kindness and the dedication of our princess, Her Royal Highness Princess Chulaporn Mahidol, the youngest princess, our beloved princess, has worked in health and environment and on the toxication to receive a lot of honorable award, honorable degree from many new university in the world, and she is our idol, environmental health idol. So is very happy. Is make our people follow her step. So during this on the 5th on the passing the May last month, we proposed the birthday of the of Her Royal Highness Princess Julaporn Mahidol, her birthday to be our National Environmental Health Day. And the cabinet have already approved for those. So this is we are very happy that we can have one of National Day, that we can have a campaign and increase our spirit of the people in the country to taking care of the environmental problem. So this year, this is first year of our environmental health day, National Day. We will have at least 4 action. The first, we will have a national campaign at the national level. That is a national level that we will campaign in many government organizations have a campaign. We will have a cleaning day, house cleaning day, and we have a campaign. Every house, every office will have cleaning themselves. Secondly, we will cooperate all the sector agency, government and non-government agency to have a meeting and enact our memorandum of understanding to take care of our environmental health. This is a big meeting will be going on. Thirdly, we will encourage people in the village, in the urban, in the community to create participation. For example, we can use the solid waste separate or divide or reuse or reduce. We will use reduce, reuse, and recycle. These 3 R's to have a campaign in the community. And lastly, we give a lot of knowledge, health education for the people or the hazard. What is the chemical hazard in the food additive or in the environment, the heavy metal and the polluted, the waste, those solid waste and all the organic or wet garbage. How we treat, how we take care. This is all the intervention will be done in the 4th of July.
Very interesting. Actually, we have a lot more to hear from you, but unfortunately our time is over. So maybe you are invited to come again for this. So Thailand Today would like to thank Dr. Pon Thep Siri Vanarangsan, Director General, Department of Health, who taught us on the environment health situation in Thailand, which will mark the Thai Environmental Health Day on coming July the 4th. So thank you very much, sir, for being here. Thank you very much. So thank you for watching Thailand Today. I'm Kusuma Yotaswood. Hope to see you tomorrow. สวัสดีค่ะ
สวัสดีครับ